Two people who were bitten by brown recluse spider developed a rare condition in which their immune system destroyed their red blood cells, a new case report shows. In the first case, a 30-year-old man came to the hospital because he was nauseous, vomiting, had muscle ache and had a painful lesion on his left shoulder. In the other case, a 28-year-old woman came in for back pain. They both had strange looking lesions. The man on his left shoulder was small and irregular shaped with a black scabby portion on one side. The woman on her upper back was target shaped and larger. Both were painful to the touch. In both cases, doctor noticed that the white of the patient's eyes were yellowish. The condition called scleral icterus is caused by a buildup of a pigment called bilirubin in the blood, which is made when red blood cells break down. Based on blood testing, both patients were diagnosed with a condition called warm autoimmune hemolytic anemia. Something was causing their immune system to destroy their red blood cell. In both cases, that something was systemic loxoscelism, a body-wide reaction to a bite from the venomous Loxosceles reclusa spider, otherwise known as brown recluse. Through brown recluse bite can be painless. The bite can become itchy, red, and inflamed shortly after the bite occur. According to the National Capital Poison Center, it may eventually become more painful, darker, and form a blister. A bite can also cause necrosis or a tissue death surrounding it and can eventually form a black scab-like area called an issue. Brown recluse bites are difficult to diagnose. Doctors make the diagnosis based on a patient history and symptom if they have any. The patients in the report were treated with intravenous fluid and corticosteroid which suppress the immune system. Both were also given blood transfusion and eventually recovered enough to leave the hospital. The man's recovery was uncomplicated, the woman's less so for reason apparently unrelated to her spider bite. She was 6 weeks pregnant and had a miscarriage and also developed a brain condition called acute metabolic toxic encephalopathy while in the hospital. This condition can also be caused by withdrawal from alcohol and drug, and the woman had a history of drug abuse, but she eventually also recovered enough to be discharged with oral corticosteroids. The treatment course went well for these patients. Some people who develop autoimmune hemolytic anemia must take a blood cancer drug with potential several side effects if corticosteroids don't work, and some may need to have the spleen removed. The brown recluse spider, a small brownish or tan spider with a dark brown violin-shaped marking on its head, lives in several parts of the United States, but is most common in Texas, Missouri, and Illinois. Most people should not lose sleep worrying about brown recluse bite as they are rare and 90% of them don't cause any major complication. Children as well as African American and Hispanic people are at greater risk for having a systemic reaction. According to the study, the American Association of Poison Control Center reported that in 2019, out of 802 reported brown recluse bite, only 24 people had major reaction and had no death were reported. The brown recluse bites were described in a report. Some of the 11 deadliest spiders are like brown recluse spider. As their name suggests, brown recluse spider have a shy nature and tends to hide away in dark, sheltered place. However, the brown recluse spider will bite if they feel threatened, and their bite can be deadly. They are usually found in the South and Central United States. The brown recluse spider can be dangerous to people because their venom contains a toxin that can cause skin necrosis. For the most part, symptoms such as burning and itching at the bite, as well as fever and nausea, develop a few hours after a bite. In extreme cases, the venom can lead to serious reaction or even death. The second, hobo spider, part of the family of a spider known as funnel web spider. The hobo spider can be recognized by its light to medium brown coloring and multiple chevron pattern V-shape on its abdomen pointing towards their head. They are often confused with the brown recluse spider, but the brown recluse is much more dangerous to humans. Hobo spiders are not great climbers, so you will find their funnel-shaped web at ground level. Geographically, they can be found in the western North America, in the Pacific Northwest. Third spider is black widow spider. While both the male and female black widow are venomous, only the female is dangerous to human. The venom of a black widow is reported to be 15 times stronger than that of rattlesnake, although they don't deliver as much venom in their bite, so fatalities are rare. Those unlucky enough to be bitten by a black widow will experience nausea, fever, sweating, restlessness, muscle cramp, and labor breathing, and these symptoms may last for several days. Brazilian wandering spider. These arachnids is aggressive rather than camping atop. Brazilian wandering spider actively hunt its prey, searching the jungle floor at night. If you find yourself in Central and South America, their neurotoxin venom is extremely painful and affect the nervous system, causing increased sweating and drooling, loss of muscle control, breathing problem, and in some cases unwanted prolonged erection. Sex spiders are in the family of Cheiroantidae and are probably account for more human bite than any other type of spider. These arachnids are distributed all over the globe, from America to North Europe and from Australia to Japan. They are nocturnal predators and during the day they hide in the small white web cocoon. Mildly venomous to human, the yellow sex spider bite can be painful and sometimes misdiagnosed as brown recluse spider bite. Their venom can cause necrotic lesions as well as redness, swelling, and sore around the bite site.